Hi, my name is Trish Wachtel, and I'm delighted to be with you today on behalf of Preschool, professionals and researchers in early childhood intervention, to share Snapshot 24. Before we begin, I would like to acknowledge the traditional custodians of the land from where I am recording this snapshot, the Larrakia people. I pay my respects to their elders past, present and emerging. I acknowledge that the Larrakia people have been raising children on these lands for thousands of years, and I honour and respect that role. Today, I'm going to be sharing a snapshot of research that looks at something very familiar in early childhood settings: rhythm, music and movement, and ask an important question: can these activities meaningfully support young children's social and behavioural development? This research snapshot is titled A Preschool Rhythm and Movement Intervention, RCT, Evidence for Improved Social and Behavioural Development. The study was conducted by Kate Williams and Laura Bentley, and it focuses on a structured program called Rhythm and Movement for Self-Regulation, or RAMSAR. Before we talk about the study itself, it's useful to think about why this research matters, what you need to know. Music and movement have been part of how humans connect, communicate, and learn across cultures throughout history. In early childhood, we see this every day through song, action rhymes, dance, and play. In clinical settings, music therapy is already well established as a way to support children's social skills and well-being. However, what is being less clear is whether structured music and movement programs can benefit non-clinical populations, that is, children in everyday early learning settings. This is the gap this research addresses. Does intentional rhythm and movement support social and behavioural development for all children? So what is this research about? RAMSAR, Rhythm and Movement for Self-Regulation, is a classroom-based program built on principles from music psychology, music education, and music therapy. What makes RAMSAR particularly interesting is that it's designed to be low-cost, scalable, and delivered by generalist educators, even with no formal music training. The program uses shared rhythmic movement activities to support self-regulation, pro-social behaviours, and emotional development. So this isn't about performance or musical skills, it's about coordinated movement, timing, and shared participation. The study evaluated the impact of RAMSAR intervention on children's early social and emotional development, particularly related to pro-social skills and the reduction of behaviour challenges for educators across the transition to school period. So let's look at how the study was conducted. The researchers carried out a randomised controlled trial, which is considered a high-quality research design. The study involved 213 children across 8 preschools. The intervention group received 16 to 20 RAMSAR sessions over 8 weeks. The control group continued their usual preschool programs. To measure outcomes, teachers completed 4 subscales of the Child Self-Regulation and Behaviour Questionnaire. Importantly, the data was collected before the intervention, immediately after, and again 6 months later, once children had transitioned into their first year of school. This allowed the researchers to look not just at the short-term effects, but whether any benefits lasted through a major transition. What did the researchers find? The findings were encouraging and quite specific. The children who participated in RAMSAR showed significantly steeper growth in pro-social skills compared to the control group and reduced internalising and externalising behaviour challenges for educators during the transition to school. Interestingly, there was no significant differences in general sociability skills. This tells us that RAMSAR doesn't necessarily make children more outgoing, but it does support cooperation, emotional regulation, and positive social behaviours. These findings align with previous research showing links between group music participation and pro-social behaviours in older children, but this study extends that evidence into the preschool years. So what does this mean in practice? You can use this research in very practical, real-world ways, especially if you work with younger children, design programs, or support early childhood development. The article shows strong evidence that rhythm and movement sessions, when done intentionally and consistently, can improve pro-social behaviours and reduce behaviour difficulties in preschoolers. This research paper provides high-quality evidence for a low-cost, scalable intervention that is able to be delivered by generalists in everyday settings where children learn and play. This research can be used to support program funding or policy change. The intervention aligns strongly with the best practice framework because it is evidence-informed, it's universal and preventative, targeting protective factors of self-regulation and pro-social behaviours. It's embedded in existing daily routines in places where children live, learn and play. The activities reflect play-based, developmentally appropriate practice, and it supports workforce sustainability and emphasises building the capacity of the everyday workforce. It is scalable and cost-effective, and it supports inclusion rather than segregation of children with behaviours that challenge others. So where to from here? The researchers suggest several next steps. Services may explore Ramsar training to support high-fidelity implementation. Organisations could trial short-term pilots to assess fit within their context. While Ramsar has been adapted for uses in places like Hong Kong, full outcome data outside of Australia is still limited. Further research is needed to see how well this approach works across cultures, language and contexts. To conclude, this study shows that structured rhythm and movement isn't just enjoyable, it can play a meaningful role in supporting children's social and behavioural development during a critical transitional period. Some discussion questions you might like to consider. Where does rhythm and movement already happen in your setting? How intentional are these experiences? And what opportunities might exist to trial a structured approach like Ramsar? And what support would educators need to implement this confidently? A little bit about the researchers before we finish. So Kate Williams is an Associate Professor in the School of Early Childhood and Inclusive Education at QUT. She leads the Centre for Child and Family Studies and is Academic Lead Engagement for her school. Kate is also a member of the Centre for Child Health and Wellbeing. Dr. Laura Bentley is a postdoctoral research fellow in the Child Health Research Centre at the University of Queensland. Laura has a background in developmental psychology and her PhD explored the impact of music on early cognition and self-regulation skills. So that's the end of this snapshot and I thank you for listening.